Hello everyone, I am Samima Banu. Today I am going to present one neurological condition, that is Cerebrovascular Accident. Introduction. First of all, we have to know about brain and its blood supply to learn about Cerebrovascular Accident. Brain is the largest and most complex part of the nervous system. It is composed of more than 100 billion neurons and associated fibers. Circle of Willis is responsible for blood supply to brain. The rupture of any of the artery or occlusion may lead to cerebrovascular accident. Definition. A cerebrovascular accident is otherwise known as stroke. A stroke is defined as the clinical syndrome of rapid onset of cerebral deficit, lasting more than 24 hours or leading to death with no apparent cause other than a vascular one. A stroke happens when blood flow to a part of the brain stops, and it's sometimes called a brain attack. This picture shows the blood clot in the middle cerebral artery and blockage in the internal carotid artery, and also an area of temporarily blocked blood flow to the brain. Causes. Stroke has many causes: head trauma, hypertension, embolism, atherosclerosis, aneurysm, and thrombolism. Types of stroke. There are three main kinds of stroke. One is ischemic stroke, another one is hemorrhagic stroke, and the last one is transient ischemic attacks. This picture clearly shows the three types of stroke in the brain. First one is ischemic stroke. It is the most common type, and it occurs when a blood clot blocks or narrows an artery leading to the brain, reducing blood flow and oxygen to the brain tissue. Second one is hemorrhagic stroke. It occurs when a blood vessel in the brain ruptures and causing bleeding in or around the brain. It can increase pressure within the skull and damaging the brain cells. Third one is transient ischemic attack. It is also known as mini stroke. It occurs when the blood flow to the brain is temporarily blocked. Symptoms. Identify the symptoms of a stroke using the FAST method. F for face drooping, and A for arm weakness, and S for speech difficulty. And the last one is time to call, when all of the above symptoms happen to a person. Clinical features: hemiparesis or hemiplegia, vision problem, dysarthria, aphasia, facial droop, and loss of consciousness. Diagnosis. First of all, we diagnose it with the FAST symptoms, and next, history collection, physical examination, CT scan, rarely MRI, and other routine investigations like blood investigation, triglyceride level, and urine examinations. Treatment. Medical management: antihypertensives, anticoagulant, aspirin, and injection of tissue plasminogen activator. Surgical treatment: carotid endarterectomy, surgical coiling, craniotomy, and thrombectomy. Complications of stroke: deep vein thrombosis, pulmonary embolism, spasticity, joint contractures with associated pain, and recurrent stroke. Thank you every one of you for listening my presentation.